So from what I can see, I think most people are connected to audio. So welcome everyone. Really excited to have you back here today for the third session of our Workforce Professional Development series. This is the last of the three sessions that we do with our Workforce Professional Development series. Today we're going to be looking at career development for your health center staff. Now, one thing that as I was building out this presentation, I really wanted to take a high level view of this because I think there's a lot of ways that we can really look at what does career development mean and how are we hopefully achieving that for the staff at the health centers. And of course, the focus is on how do we then utilize this as a recruitment and retention tool. So we're going to go ahead and just jump right in. We have a few housekeeping slides, just like we always do. And I know many of you have been throughout the different sessions. So please just kind of hold on with us and then we'll dive right into the content. So the session is being recorded. The recording and the slides are going to be sent to all registrants. So you will be able to get that, share it back with your health centers, whatever you would like to do with that content. Please also feel free to use the chat box. So ask any questions, share any comments or thoughts. As I go through the presentation, don't feel like you have to wait till the end. If you have any questions on any slide or anything that I'm bringing up, feel free to put it in. I try to really keep eyes on the chat box as I go through presentations. And I believe as well, and Mariah, please correct me if I am wrong, you could also do the raise hand symbol and we can unmute you. But Mariah, am I misspeaking on, on that one?
No, that's correct. Folks can raise
Okay,
their hand
perfect.
and let me know, and I can give you that permission.
Perfect, perfect. So yes, if anybody wants to say anything, feel free to just do the little raise hand symbol and we can unmute you. And again, don't feel like you have to wait till the end. I always like to take questions or any comments throughout and we can definitely have a dialogue. I've already mentioned Mariah. I know many of you on this call already know our amazing Mariah Blake, but if you do have any technical difficulties, please go ahead and contact Mariah directly and she will be able to help you. And then as we do with any of the trainings that we provide, we have an evaluation at the end, and we would be so grateful if you could please fill that out. It is part of the requirement for our HRSA cooperative agreement, but more than anything, we just want to know, like, what we did well, what we could improve on to really bring you the best technical assistance that we can provide you. Okay, so like I said, few housekeeping slides. We're here today with ACU. So for those of you who may not know, we were started, I think it's almost like 30 years ago now. I believe our 30th year may be coming up fairly soon by National Health Service Corps alumni. We have just a lot of different types of programming, specifically myself and the rest of the STAR Center team that you see. We're here focused on workforce recruitment and retention. So the program that brings us here today is the STAR Center program. And with this slide, what I really like to point out is the training, the technical assistance, the different resources that we provide are all free for you to use. And of course, if at any point you have any questions beyond this webinar series, always feel free to reach out to us. We do have a separate website from our main ACU website, and that's just so that we can house all of the specific STAR Center resources for you all to access. So that is chcworkforce.org. And you can also contact us at info@chcworkforce.org. That does go to a real person, my colleague Sydney Axelrod, who I saw just signed on. And then she filters out the questions as appropriate to the team or other individuals at ACU. So this is the amazing STAR Center team. I believe on the call we have Mariah and Sydney on today. I am Michelle Fernandez Gabilondo. I'm going to be the one doing the presentation. And then we also have Suzanne Spear, who is our VP of Workforce Development. And for this slide, you have our direct contact. So, if you don't want to use the info@chcworkforce.org, you can just get our emails from this slide. And like I said, all of the slide decks for this entire webinar series are going to be shared with everybody who registered along with the recordings. Okay, so these first few slides, if you've been in the other sessions, you've already seen these, and actually probably if you've attended any STAR Center training, there's a really good chance you've seen this slide. But we really are conscious in continuing to include it because we really want to just like hone in to that idea of just how fundamentally important your workforce is. If you don't have a workforce, you don't have a health center. But we also want to recognize it's expensive. When you are investing in your workforce, that is an expense. But really, what we argue is that it is still a critical thing that needs to be done when we're looking at how are you retaining the staff that you have? How are you recruiting the staff? What are you really setting up to ensure that people want to work where they are and they want to stay there? And that does require an investment. But again, the workforce is the fuel of your health center. Part of that investment comes in these different core components that we talk about. And again, I think this is a slide that many people have seen, but I always like to put it on here. So these 8 core components that we developed at ACU, it's really looking at what does it mean to be a high functioning health center. And today we're going to be talking about career development, pathways, and all of these different components really play into it in one way or another. So as you can see here, health professions training programs, there's going to be a few slides on health professions education and training because that is very much part of pathway development or even just career development. As you're working on building these programs, you want to make sure that you're testing everything, that it's really in line with the policies and procedures of your health center mission and values, that the individuals who are going to be the high functioning managers are either properly preparing their staff to move through this development, through these career pathways, or that you are preparing people to become those high functioning managers, that there is organizational engagement. When we talk about pathways in career development, it really needs to be aligned with ensuring that there's an effective compensation structure that you're following as part of your data-informed workforce plan. And if you do have a chief workforce officer, that they really are that strategic thinker around the development of these pathways and just the career development for anybody who really works at your health center. So it was really looking at how all of that fits together. And then, as you know, again, if you've been to any of our trainings, you probably have seen this really beautiful graphic that was created by one of our former STAR Center team members, Helen Ravenier, who is just always amazing as well. And this is really just saying, think about the comprehensive workforce plan. I know a lot of you have heard so much when it comes to comprehensive workforce planning. But when you're doing a development strategy, there's a component for that. And that's something you should write down, you should put in your comprehensive workforce plan. And then a subset of that is really that HPET plan that is part of the larger comprehensive workforce plan. So, this presentation is not about like the comprehensive workforce planning per se, but I always want you to keep that in mind of any of the strategies you're building, anything that comes in line with your workforce, to write it down and put it in one place, both so people can go and they can see the history of the different strategies that you're putting together. What is the data that you're using? But also, when you're doing your OSV visits or operational site visits, if this is asked of you to show your comprehensive workforce plan, that you have this ready to go. And all of you have these components. You're doing so many amazing things when it comes to supporting your workforce, especially right now with so many limited resources, that the more you write it down, the more you test it, the more you ensure that people know exactly what their roles are, what they're supposed to be doing to advance recruitment, retention, anything workforce related is really, really important. So just really wanted to put a plug for that as well. So with those slides that I know many of you have seen many times, we want to just go ahead and jump right in. So throughout this presentation, like I said, I'm taking a very high level view of this because I think we can talk about career pathways, career development, but there's a lot of subcategories or things that really align closely to it. So as I speak through this presentation, you're going to see that I may use some terms a little bit interchangeably, but at the end of the day, really what we're trying to get at is how are you, when you hire someone, when you have someone working at your health center, regardless of the role that they play, how are you developing that person and ensuring that they have some type of pathway to build a career? Especially right now, there's a lot, health centers have very limited resources, and career paths is a critical part of retention. Turnover is very, very expensive. We know this. And we know that turnover is a problem and continues to be a problem. And one thing that I've said in a lot of presentations that I have done is that when you're looking at people who are coming to work at health centers or really any type of mission-driven organization, they're seeking that out for a reason. They're seeking out that mission. And a big part of that is that it's not just a job, but really, what is that organization doing to support my career? So, strategizing with your leadership team and with everybody really at the health center to build something for people is really critically important for them to feel like, okay, I'm really coming to work at a place that values me and that is investing in my career. And it does really make a very positive impact when it comes to the overall retention that you're trying to achieve at your health centers. So, as I said, I wanted to look at this broadly because there's a lot of things that either really align with each other or they kind of parallel each other very closely. So, when we look at the concept of workforce development, that's huge. That can mean so many different things. So, as you're really trying to narrow down your strategies, how you're building out everything, what are things that you should be thinking of? What are those? This is sort of like that initial thought process of looking at what is needed for our workforce in our health center. And then out of these different potential strategies that you see here, or even more, what are you really going to focus on and focus your investment in? Because when we have limited resources, I think the planning part of this is really critically important because when you put time, money, investment, whatever it may be, you don't want to put any type of program or strategy out there that just isn't really going to be used by the individuals that it's meant to support, that it's still going to really not support the lowering of turnover. There's a lot with career pathways and development connected to stuff like well-being. So we want to think through what makes sense for us in our health center. Where do we want to focus our time and our money and our investment to really build out something for the staff that really hits on exactly what they need? So most of the presentation today is going to be talking about career pathways and especially around the idea or the actual application of skill building, that regardless of however you are developing your staff, skill building really needs to be at the foundation of that. So then we can also look maybe even a little bit less formalized. What are some advancement opportunities? Some of those, are part of those career pathways that people are building. So someone may go in and already know, in 3 years, if I'm able to follow this career pathway, then I am able to advance to this next step in my role. Others just kind of come as they go. So, someone may have left the organization that then opened up a position that allowed for an advancement opportunity for someone else. And this is why things such as talent development, leadership training are so critically important. Skill development as well, and we'll really get into that, is because you want to ensure that people are prepared to take those next steps. I think we've all either been in this situation or known someone who is in a similar situation where just out of necessity, position opens up and you move someone up to that position, but there wasn't really the training, the skill building, the preparation for it. And you don't want that either. You don't want to, develop someone, move them up into another role, and they don't feel prepared. So there's a lot of planning again that goes into this. While the presentation is not really going to talk much about this, I did want to put succession planning in here because this is a really important part of those pathways, especially now as we see a lot of people retiring from those higher level positions. You really need to think through, how are we bringing in that new generation of leaders? How are we bringing in that new generation of workforce? And that's not to say necessarily people who are younger, it's just who is coming into the workforce and how are we preparing to fill in those positions where we know people are retiring or they may be leaving. So as you're building out career pathways, as you're putting together skill development, as you're identifying who are the next generation of leaders, all of those things, that should also be going into your succession planning. And it's really, really important to take that into account and really think about succession planning because people will leave. Sometimes things happen. So the more prepared that you can be, the better positioned you are. And then at the end of this presentation, there's going to be a little bit about health professions education and training, because that is also a really important part of workforce development. This really hits on the part of where we talk about growing our own. And again, I don't feel like I'm saying anything that any of you don't know, but we know there's a lot of workforce challenges. The demand, there's simply just not enough people for the demand that we have in healthcare. And we also see less and less people going into these professions. A lot of changes are taking place. Health centers are really facing a lot of different potential barriers that may come up when it comes to their recruitment and their retention of their staff. So being able to have, an HPT plan really helps you again with that concept of like, how can we really grow our own? So we'll talk a little bit more about that towards the end of the presentation today. But this is, again, just some strategies to consider and things to think about as you're looking at the concept of workforce development. Now, this is just, again, high level, but if you want people to stay, there is the need to invest in them. There is the need to invest in their career. People want to know that they're coming to work at a place that they are being supported. So that's really what this slide is saying. When you offer those opportunities for professional growth and advancement, people are more likely to stay. Now, I think when we look at workforce, when we look at the entire just field of healthcare, so much has happened so rapidly, but this concept of like professional growth and advancement really continues to be a cornerstone of retention. We know that people, when they do leave jobs, sometimes, they're leaving because, issues with management or with communication or things like that. But there's also the reality that people think, okay, I really did achieve the highest that I could in this organization at this moment. And the only way for me to really move to that next step in my career is to then maybe seek out employment somewhere else. So how can you mitigate that as much as possible and open up those pathways so people feel like, okay, I am continuously growing and advancing in my career and in the work that I'm doing? So just those development strategies, again, what are you thinking about and what are you looking at? It's really important that as you're building out career pathways, as you're building out any type of workforce development, that you're taking into account what people need to succeed into that next step. So in a few slides, we're going to dive much deeper into the concept of skill building, but everything from professional development, make sure it is accessible for the individuals who work at your health center. And I do want to bring back this concept of knowing there's a cost involved with this. I know that there is an investment and it is expensive to support professional development, to support continuing education, to support mentorship, but that investment most times will still cost less than what it means to lose a provider or really to lose anybody who is working at your health center. So again, it's really trying to be more proactive rather than reactive in an environment where right now resources are limited. So you have to really think through where do we want to put those resources to really get the best return from that. And when we look at professional development, continuing education, it also does not have to be something too convoluted. It doesn't have to be, even a fully fleshed out plan yet. A lot really falls within those categories. So, even giving your staff like an hour if they want to attend a webinar that they know will really help them in their role. And, it's a free offering, so nothing really that it's a huge investment, but just giving them that time to do that. Opening the lines of communication between the supervisor and supervisee on what are some continuing education that they may be interested in. If the health center is able to offer some financial support, especially when we're looking at clinicians who need continuing education for their licensing or to go to conferences. So these again are just some ideas of what you can do, but you need to also see what works for you and your health center. Another one is mentorship. So one thing I will say, I think mentorship is really critically important. I think everyone has had that person in their career where they look up to them and they've learned so much from them. Sometimes it's more formalized, sometimes it's not. So, this doesn't necessarily have to be something fully formalized, but it's really important that you're giving people avenues to just be able to grow. Another thing that I want to say when it comes to mentorship, though, is as you're identifying people that would make really good mentors in your health center for the newer staff who are coming in, that you're also not overburdening them with that. So when you're identifying people who are interested in being mentors, of really making sure that this is something that they want to take on, that they're comfortable taking on in their role, and ideally ensuring to compensate for that extra job essentially that they are taking on and doing. It's also important to remember when we do career pathways that experience is and development, that experience is just as important as education. There's some roles that obviously require certain education in order to be able to do that. So, if you're looking at a physician, having to go to medical school in order to have the license to be a physician. So things like that. But that's not the case with every role. And I really want to hone down and say, when we're talking about pathways, when we're talking about development, I don't want it to also solely sit with just providers. I want you to think across the organization because everybody plays a really critical role. So how are you developing the people who work at the front desk? How are you developing people who work in IT, in your finance department, your MAs, your DAs? And again, this is where you look, what makes sense for our health center? What are the roles that we really, really need to retain people to then start building strategies that are supporting those critical roles that that you either have a hard time recruiting or a hard time retaining for, and really putting your investment there. And then finally, I feel like I already said this, but that investment is just helping people really be successful in achieving getting to those leadership positions. And for some people too, and I'll talk about this in the skill building slides, it's not even this need to get to that leadership role. They may really love what they're doing. And that's what they plan on doing. They're like, this is why I studied what I did or went into the field that I did. This is the job that I want. But nonetheless, things change so rapidly. Skills change when we're looking at the inclusion now of AI in healthcare. There's so many things that are rapidly moving that it's really important that when you look at pathways, when you look at development, that you're also taking into account just what skills do people need to continue to do the job that they're currently doing. So for some, it really is taking those next steps into leadership. And for others, it may just be advancing within the role that they're doing and just getting better at it and building their expertise for the job that they do day in and day out. I wanted to put this kind of map on here, and I kind of went back and forth a little bit about whether or not I wanted to include this slide, and I decided to do it. And the reason is this is a very kind of super, super simple way of looking at this. You start your career, you hit these milestones, you get to the middle of your career, you hit these other milestones, and then you get to leadership. Well, going back to what I said, this may not be the trajectory that everyone wants to take. But ultimately, it's really important when we're looking at these milestones that we're letting people grow. So either growing into those next steps, going higher up, moving up into leadership, or simply growing in what they know in the role that that they're doing. I'm going to use really quickly. My background is in social work. I know I recognize a lot of names on here today, so I know many people already know that about me. But I have a lot of friends who are clinical social workers who work in health centers. And for some of them, the way that they're looking at their pathway and their workforce development is not necessarily this sort of ladder, but rather they just want to be the best therapists that they can be. So constantly ensuring that they're doing professional education in different modalities, that they're really learning about the populations that they're serving, whatever they may need for their licensure. So that is an aspect of pathway development. While for others, they came into the field, they were very interested in offering therapy, being clinical social workers. But as they continued throughout their career, they realized, okay, I now kind of want to change a little bit. Maybe I want to move into a leadership position or more of an administrative role or even into a completely different department. So again, this is where this ladder kind of makes a little bit more sense for some of those individuals of how are we letting them take those next steps. But regardless of what it is, it's this concept of how are people building the milestones that they need? What are the competencies that they're supposed to be meeting to be able to take those next steps? Another really important thing when we're talking about this is that you need to see what your staff wants. Don't just sort of assume we're going to build this and everybody's going to use it and it's going to be great. No, this needs to be a very individualized process. And I do this with my own team of like, where do you want to go from here? Like a big part of my role is how can I then bring that back to senior leadership, ensuring that there's professional development, continuing education, things like that. So this is a very simplistic representation, but I think it can fit into many different ways of what people want to achieve in their careers. So as I said that, the reason I had that slide before this one was really to hone into that point. So we talk a lot about career pathways, but I think oftentimes what we really mean when we're talking about that is career ladders. It's that like, okay, taking that next step, moving up until I'm, whatever the highest role that I can get to. And that is my goal. And for some people, that's exactly what they want to do. And that is wonderful. For many other people, the pathway really is, it's not just going straight up, but it's, and it's not even linear necessarily. It's about progressing in their careers, but in a way that makes sense for them. So maybe it's achieving more professional development so you feel more comfortable with a certain skill that it's already part of your role, but you just really want to grow in that skill. Or maybe it is, I am in a certain position and my goal is to then be a manager so I can start supervising people. So how are we training people and building those pathways so that they're ready to take that next step? That management piece is also really important. As you're building career pathways, as you're developing your staff, if you are moving people into management roles, supervisor roles, make sure that you're giving them the skills that they need to effectively serve in that position. Because you can have someone who is just absolutely amazing at their job. Like every single qualification is there, they know exactly what they're doing, but managing people is a whole new thing and it takes a whole new skill set. So you have to be really, really conscious and careful about how are we building these pathways for people. And then ultimately, again, going back to what I was saying, what is the end goal they're hoping to achieve while also meeting what are the needs and the gaps that we have in our health center when it comes to certain open positions, succession planning, leadership building, anything of that nature. So I talked about how a lot of this presentation was going to be on skill building because regardless of what you're doing, how you're doing it, people's skills need to be constantly built up. Things change. Like I said, I think especially right now, one of the biggest things that I'm seeing and all the different meetings that I've been to and things like that, it keeps coming up two topics when it comes to skill building is ensuring to build skills for people to better understand how to use AI in the role that they're in. And honestly, AI really affects almost every single role, where it could be somebody, how do you effectively utilize that for somebody working in the front desk to help streamline as people are coming in? How can it be effectively used with providers for, medical documentation, all of those things. But again, this is a skill that is needed and people need to be trained on. And it's part of that professional development, part of those career pathways that you're creating for individuals. Another one that we hear a lot about is leadership development. And again, I think this goes back to the more kind of standard of like, what's that next step that I can take in my career to get higher up in that leadership ladder, essentially. So what are some, key things when we look at career pathways and skill development? If this is something that either you have more formalized or not necessarily formalized, but something that you are doing in your health center, it's really important that you disclose to people what the skills are. So let's say somebody has a really strong interest in, they've come in to work at your health center in their current role. They don't really supervise anyone, but that is something that's really important for them in the future to eventually be able to do. Well, as that person's supervisor, as the leadership, as the organization, really ensuring that they understand what are the skills that it takes to be a high functioning manager. So effective communication, conflict management skills. And that's actually, I'm pulling both of those because those are Sydney's areas of expertise. But again, this really, you have to work in tandem with the individual and with your staff. You have to determine what are the required skills and competencies for the various roles and career stages. And you really should write this down and make this available to staff. Again, this can be even part of like the yearly reviews that you do for people. Are they meeting certain competencies? And if not, how can they achieve that? Like, what can you provide them to better support that for them? Because again, we can't just assume like we give people like, here are the skills you need, here are the competencies you need to achieve. But if you're not giving them the opportunity to do professional development, to do continuing education, to get what they need in order to build those skills, then it's really not going to work. Important to identify any available training. And I really already mentioned that. What are those resources that your employees can use to gain those skills? And then just clear and consistent communication with your staff. There's some health centers, and I use this health center a lot as an example, actually. And now I'm forgetting their name, but I believe they're in Colorado. They have this amazing dental assistant career pathway program. And I believe it took them years to develop it. Any dental assistant who comes in, they're automatically part of that career development, career pathway. And essentially, they go through a lot of education, a lot of training that extends even beyond what a dental assistant needs. So they're learning things about HR, they're learning things about like, other aspects of healthcare, of finances, because the thought process behind this is we really want to build a well-rounded employee. And whether or not they want to stay as a dental assistant, at least we're giving them the skills to really move across and learn a lot of different things. But it is an established program. So as people go through the training, they automatically know, okay, after a year, like this is when I move into the next role and I'm able to get promoted, and then I continue and I'm able to get promoted. And for those organizations that maybe have something more informal, it could be working directly with your supervisor to really see, okay, what is that next step I want to take? And as an organization, how can we support you in that? But at the end of the day, people, that needs to be clearly and consistently communicated. You should really have a lot of these discussions with your direct supervisor when you have your one-on-ones, when you do your yearly evaluations, in your onboarding process too. I know it may sound a little bit strange, but once you hire someone, you should already be talking to them about what potential career pathways may be available to them. What are different things that you can do in order, again, because what you want to do is to show the individuals that are working in your organization that you are investing in them. And that makes people more likely to stay. And I just go back to the turnover is probably going to cost a lot more than it is to really put some time and investment into these career pathway and career development strategies. And I feel like I already said this, but I wanted to keep this slide of just like, the only way to prepare your organization for the future is by putting skills at the center of your strategy. I mean, it goes back to what I said earlier. If you don't have a workforce, you don't have a health center. But if you don't have a workforce that's trained for their jobs, that has the skills that they need to do and support and, the patients that you serve, the community that you serve, you are going to have so many different issues that are going to come up. So it's not just, do we have enough people that work here? Are the people that are working here trained properly, have what they need, and that we're developing them in a way that is really taking into account where the future of healthcare is moving to, what those future needs are, so that this all essentially trickles down to offering the best services to your patients and to the community. So, what are some ways to look at skill building? And okay, I just wanted to see if there was any questions. I know I've given a lot of information, so if anybody has any questions, anything, just feel free to put them right into the chat, and we can definitely dialogue about that. But as we dive a little bit deeper into skill building, I want to talk about three concepts. So upskilling, cross-skilling, and reskilling. And this is going to connect a lot back to what I talked about earlier, where it's, what does that person need? What does it make sense for them, and what are they looking for in their career development? But it also has to line up with what, as an organization, are you looking for? What are the skill gaps that you have in your workforce? What are some of the gaps that you have in certain positions? Do you know that certain people may be retiring soon? So you have to ensure that you're upskilling people so they're prepared for that, that they're prepared to take that next step. So again, there's a lot of strategy between the individual, the person who's working in your organization, and what are the organizational needs that you have in order to fill in those gaps. So skill building is a really good way to look at that. And I really like this slide. We've used this slide in a lot of our presentations, but I think it just gives a really nice visual of what does it mean to reskill, cross-skill, and upskill. And I'm going to start before I go to the cross-skilling, the one right in the middle. I'm going to talk first about reskilling and then about upskilling. So reskilling is exactly what I was saying, where not everybody just wants to move directly up in the career ladder. That's not necessarily what everybody's looking for or what everybody wants to do. But so many things are changing so rapidly that it's really, really important that you are ensuring that people have the skills that they need if they're going to switch to another lane or switch to another role. This is, going back to that example that I gave with social workers. And what's interesting to me is the friends that I have talked to who have been very interested in reskilling while they've been working as clinical social workers. Some of them have really felt that there was sort of this idea of like, well, you're in behavioral health, so that's what you'll always want to do. And that's not necessarily the case. Many of them have had a really strong interest in going into more administrative roles, C-suite roles, or even working in other departments within the health center. But because reskilling was not really part of the strategy that was taking place, the health center ended up losing some really great employees. While yes, they may not have been in the same role, they could have been moved into other positions, and you've already would have had somebody who understands your mission, your values, the population you serve, and so much of just the day in and day out of the organizational norms. So when you're reskilling someone, you're really looking at has that interest in switching lanes and really moving into new roles, whether it's within their department or outside of their department. Then you have upskilling. This is a lot of where we're looking at more of that straight up career ladder. People want to increase their knowledge, their competencies, that are related to their current position in order to hopefully take those next steps. So, regardless of whatever you call all of this, I think it's just really important that you strategize and you think about exactly what you need for each role and what people need. I really personally like the cross skilling. So, this is where you are developing skills across multiple functions. And I think cross skilling really takes into account the concept of reskilling and upskilling. So, here what you're looking at is okay, what are those new skills that people need in order to switch roles, to move to different departments? How are we able to give them that while still ensuring that they're getting the upskilling within the role, within the department that they're doing so that they can really fully like flesh out every type of skill that they may need in order to succeed in their role or in another role. And then as an organization, this is where you would come in and identify like what are those skills that we need? What are those gaps that we have so that we're effectively ensuring that people are getting the professional development or continuing education that they may need. And I see that there is in the chat, so just give me 1 second. Yes, Sarah. Yep. Um, Yep, absolutely. So we had mentioned it a little bit earlier, but all of the slides are going to be provided to everyone and actually everybody who registered, and it's for the entire webinar series. So if you did not attend the first two, you should have gotten those slides and the recording. And then this one, once we process the recording, have the slides up, you will get an email with everything to follow up. So yes, absolutely. Oh, and I'm glad that it helps with with the concepts. And thank you, Mariah, for sending the response. But yeah, I will say this is probably one of my like favorite slides that I have just because of the visual. And I just really like this concept of the cross skilling because I don't think you can only really stick with one or the other. Like people need to really be able to, advance in the skills in the current job that they're in, that you're upskilling them, that you're making sure that they're able to move up and advance, and that they're also learning new skills, that you're reskilling them. And there's a lot of ways that this can be applied into any position. I think any learning that you do can really be applied into any type of role you may have, but you just need to be strategic in understanding where are the skill and role gaps in our organization and who are the people that we're identifying as being the right individuals to really fill those gaps and that we invest in order to do that skill development. Oh, and then there we go. Sorry, it wasn't going to the next slide. The other thing that I did want to talk about, so if we're looking at career pathways, career development, a big part of this is the concept of leadership, especially for those who are like, I want to move up. I want to move up to a leadership position. I want to move up to a supervisor role. I want to take those next steps in my career. One of the strongest things that you can do as an organization, especially for those who are direct supervisors, is really start identifying who is showing these leadership characteristics, who really like. And I think all of us in organizations, we kind of have those people that just stand out a little bit, and you're like, yeah, they would be good leader. They would be a good leader. They have those qualities. And I really like this sort of just kind of very simple list of what are some key qualities that it takes to succeed as a leader. And, I just mentioned of the importance of identifying that in people. But what you'll see here, so integrity, delegation, communication, self-awareness, gratitude, learning agility, influence, empathy, courage, and respect are all also skills that you have to work on and that you have to train people on. So we can't also just assume that everybody's going to magically have these qualities and that they're going to know exactly how to use them in the workplace. So it goes back to that skill development and that investment of the professional development, the continuing education. We do a lot of trainings on communication, for example. So going to call out Sydney again with that. But the reason for that is that this isn't necessarily natural for everyone. Every organization has different organizational norms. Every, place where you work, every role, everything changes the way we communicate with people. So you have to continuously ensure that you're developing people skills so that when they do move into those leadership positions, if you have succession planning, whatever it may be, that they have what they need and that they're ready to really move forward and be as effective as possible. The other thing that I like to point out with this slide are two of these characteristics. One is empathy. I think empathy is a word that a lot of people use very differently, but like everything else, it is a skill. It's a soft skill, but it's a critically important skill to be very effective in the workplace, especially when we're looking at healthcare. You're working with a variety of populations, people who are in leadership positions, being able to bring empathy to the people they're supervising. That is a critical skill that you really should focus in any type of career pathway development that you are doing, that you're giving people some type of professional development to really understand what it means to have empathy in the workplace and show up in that way. And I think there is a question. Just give me 1 second. Oh, and then Sarah said we just identified core competencies across the organization. Next steps are to incorporate them into, yep, job descriptions, performance reviews, career development, and pathways. Thank you so much, Sarah, for including that, because exactly. As you're identifying these core competencies, these skills, and again, I think the terminology we're using is not as important as the concept itself, that you're actually doing it and putting it into play. So I really love that you're talking about, you've identified the core competencies that are needed for your organization, and then you're putting them across different things. You have them in the job description so people know right away. The performance reviews, this is an excellent time when you can meet with your staff and talk to them about that skill development. One really important thing with performance reviews is that if there is an issue or if something were to come up, that should not be the first time that employee hears about it all of a sudden in the performance review. That's why this ongoing pathways, the ongoing development, the ongoing, skills training is so critical, because this is where the supervisor is working directly with the employee to make sure they're meeting those metrics that as an organization you need and you're looking for. And then, of course, it's all wrapped into that concept of career development and pathways. So thank you so much, Sarah, for that. So I really just wanted to point out that piece about empathy. And then the last one I'd like to point this out as well is around influence. I think as someone is stepping into leadership, obviously influence is a huge part of it, but we have to really know, how are we wielding that influence? Because influence can be very positive or it can be very negative. So think about any type of professional development that you may do, any type of career pathways that you may do. How are you really talking about these skills, and how are you really implementing them and training people on them? Because you want to make sure at the end of the day that when people are trained, when they're prepared in their roles, that they're approaching this from the most positive way possible. And what I really mean by that is that they're prepared to have healthy communications with their coworkers, that, they're prepared to lead with integrity, that, they have a lot of self-awareness in the role that they're doing, but all of that takes a really planned out and strategic way of doing professional development. But that's the reason that I point out influence, is because influence can be really great, but we all know some people that have really not so great influence. So we want to look at this from that lens of like, what is helping the individual and what is helping the organization as well. Oh, give me 1 second. There we go. And as I said, as we sort of come to the end of the presentation, I want to try to leave a few minutes for questions. A big part of career pathways and career development is health professions, education, and training. How are you growing your own people? And we really need this as health centers. This is so critically important, because there just isn't, the demand just continues to outweigh the amount of people that we have in the workforce. And this really means getting to people early on. Like in high schools, I've seen Some health centers are working with people in middle schools. I know my high school had like a pre-med program that was aligned with the local community college and things like that. So you again, think about how are we growing our own people to ensure that we have the workforce that we need in the future. When you think about health professions education and training, it tends to have better employee satisfaction, less retention, has a pretty positive impact on the positive economic impact on the community because obviously you're opening up more positions. People, have access to more jobs. HPT2 should also, you shouldn't only think about it as sort of clinical, or I know a lot of health centers and a lot of places are like, oh, that's a huge undertaking. This is where we're thinking about, residency programs and things like that. But it can be more informal. It could be a mentorship type of program. It doesn't have to be something too complex if you're just not at that stage to offer that yet. When you have these programs, though, when you have these pathways, it helps with the time to fill open positions, gives greater access to care and increase efficiency. And I did want to put this like data point where nearly 60% of medical residents, and again, HPT is not solely residency programs, but I think this is an important part of they will practice within 100 miles of where they did their residency. So if you can have people training in your health center, you're in a much better position to hopefully retain those individuals who were training there. And then as they come in as full-time employees, you want to continue that career pathway. You want to continue that skill development for them. Like it doesn't just stop after the training. The training is ongoing throughout. That's why it's a pathway that they're going through. And I mentioned there's a lot of different ways to look at this. So, oftentimes this is where we look at the internships, externships, residencies, things like that for the clinicians, but for community health workers, training programs for them, medical assistant, dental assistants, field placements for mental health providers. There's a lot of ways that you can look at this. I know there's health centers that even have career pathways for like their IT individuals, people in finance, people in the front desk. At the end of the day, again, this is just showing the investment that you're making in people, and people want to know that their employer is investing in them, and they are more likely to stay when they can see that. Now, as with every single thing I said, of skill building, developing pathways, trying to focus in on cross-skilling, HPT programs, I want to make it known that I know that there's a lot to this. This isn't, you're here for 60 minutes, you go back and then magically all of this gets done. No, this can take years to really develop. And that's why it's so important to really start the process, to write it down, to strategize, to talk to your staff, to assess where the gaps are in your workforce, all of those things, because here's where you're looking at what is the commitment, the workload that people are taking on. Leadership buy-in is critical for this. Do we have the staffing in order to take on so much of these things? So, for example, mentoring. Do people actually have the time to be a mentor for other people in their organization? There's a cost involved. So, regardless of what you see works for you in your organization, I was so happy that Sarah put that in the chat because it seems like they are already taking those steps. Make sure that you just have realistic expectations. So, assessing and preparing is critical. Don't just jump right into this. Make sure that your team, your leadership team, your supervisors, other people and staff are really involved in these discussions to find what do we need as an organization and what does our staff need as employees. A big way of thinking about this, and this slide was also in our previous presentation, but I was trained a lot in human-centered design, and there's many more layers to this than just what's on this slide, and I'm just going to talk about it for a very, very short period of time. But at the baseline, all this is saying is whatever you're putting out there, whatever strategies you're putting together, whatever pathways you're building, no matter how robust or how informal they may be, that you are taking it step by step, that you're starting by assessing where our needs are, And you're starting by talking to the people who are going to be involved in this in all aspects, the person who may be going through the career pathway, the person who's that individual supervisor, the leadership who is seeing like, okay, what do we need as an organization? What are roles that we need to fill? That everybody is really involved in that thought process, that as you start rolling these programs out, you don't have to also do something huge. You can do something small where you're really ideating, how does this work? And test, make sure to test, look at the ideas, see what is working and what is not working. Because what's going to happen as you're building core competencies, as you're building skill development, as you're building an entire program, if that's what you're going to be doing, so like a residency training program or a really established career pathway, that is going to continue to evolve as your workforce changes. So you have to continuously test to see, is this still working and is this still meeting our needs? And I've said that a lot about needs throughout this presentation. And I did that for a reason, because that's really ultimately what you're kind of carrying. You're looking at what are the needs of the organization, what are the needs of the people, what are the needs of our patients, what are the needs of our community, and then how do we build a strategy to support that? And then ultimately, as you do all this, then you can really start implementing these strategies that hopefully you put in your comprehensive workforce plan to really maximize the impact of what you're trying to get from this. Also, I do want to say, if you have something much more formalized, even if it is, informal, but you already have a strategy in place that is working in your organization, as you're recruiting people, put that in your job announcements, have those conversations with them in the job interviews. Like, people are looking for this when they're seeking out different roles. So really important that this is communicated to anybody who may already be working or may be working in your organization in the future. And then as I end today, okay, good. I was hoping to at least leave like 3 minutes, possibly for questions. This is another slide you all have seen, but we like to put it in almost all of our presentations because turnover is expensive. The problem is sometimes with the investment in, skill development and career pathways is that it's more of an upfront investment. So you don't see that return on investment. It's much more long term. It's not necessarily always short term. So what we do with this slide, what we have hyperlinked on here, the STAR Center Financial Assessment Provider Turnover Tool, gives you a tool that helps you start collecting that data of seeing what does it really cost us when we lose someone, especially providers, because that's what this tool is focused on, versus what is it going to cost us in these investments that we're hoping to make for the development of career pathways. And bring that data as HR professionals, as workforce professionals, as supervisors, whatever your role may be. When you go to leadership to get that buy-in, bring that data, show that comparison, because those numbers can be really, really powerful in ensuring that you have the investment that you need to build out skill development core competencies, like Sarah put in the chat, and ask yourself those questions like, what is going to really cost us more, and what are we getting short-term and long-term in the outcomes that we want to achieve? And ultimately, what it is retaining the right people and retaining the mission-driven individuals who are going to be providing your patients in the community the best services possible, even with such limited resources. So I know that was a lot. And I think we only have 2 minutes, but does anybody have any questions? And if not, think about your questions, put them in the chat. I am just going to go to this slide. So if you all want to join our newsletter, you can just do put your phone up to the QR code. And then of course you can reach out to us at any time, and we're always here to offer any help. And then, Rima, yes, of course. Thank you, Rima, for being here. Rima is one of my favorite people, so always excited when I get to see her on any of these calls. And actually, in this call, I'm seeing a lot of people that I recognize, so welcome all. And then Mariah is going to pull up the evaluation in just a moment, and we would just be really grateful if you could fill that out. And I'm not seeing any other questions. And think about the evaluation as kind of like your ticket out of the room. So I would really, again, we would really appreciate that. But thank you so much, everyone. Feel free to reach out at any point, and just remember, I think we've, every single one of us, regardless of the position we have been in or the roles that we've played in any organization, we've all needed to have skill development. We've all needed those mentors, those people that are helping us in this pathway. And all of you, as these workforce professionals, are in a really great position to really inform what the future of the workforce is going to look like, what the skills are, what they're going to be learning, and then the impact that they're going to be making in the community. Okay, so we're right at time. So again, just thank you, everyone. I don't see any other questions in the chat. I don't see any hands up. So I just hope everybody has a really wonderful afternoon.